Welcome to this presentation on stroke education. My name is Sheena, and I am a stroke case manager from Changi General Hospital. I will be presenting this topic with Mr. Lim Yi Tian, a pharmacist from Tan Tock Seng Hospital. We will be discussing the importance of providing stroke education to patients and their families, and discuss the key elements of stroke education. Based on 2018 guidelines for management of acute ischemic stroke, it is strongly recommended that patients with stroke be provided with information, advice, and the opportunity to talk about the impact of the illness on their lives. As we all know, prevention begins with education. Effective stroke education is a hallmark of better stroke care and secondary stroke prevention. Information offered should be tailored to meet patients and their families' individual needs. This will empower patients and their family members with the knowledge on recognizing stroke signs and symptoms, knowing when to seek immediate medical attention, and how to reduce the recurrence of another stroke. This is the stroke education material initiated by Stroke Services Improvement Team in collaboration with all the public hospitals in Singapore. Aside from this education material, there is also an online resource available for patients and family members such as Stroke Hub.
During the stroke education session, these are the contents that we will discuss with patients and family members. Time is essence in treating a stroke. Patients should learn to spot early warning signs and symptoms of stroke using the acronym FAST and seek early treatment. Other signs and symptoms of stroke includes visual disturbances, uncoordinated movement, severe headache, and giddiness.
After a first ischemic stroke or TIA, the overall risk of recurrent stroke is high, at approximately 20% at 5 years. It has been suggested that 80% of secondary strokes can be prevented by a combination of lifestyle changes and medical interventions. Every stroke patient should be assessed and informed of their risk factors so that possible strategies will be discussed to modify their risk factors. The risk factors that can be controlled includes high blood pressure, high cholesterol, diabetes, smoking, atrial fibrillation, and unhealthy lifestyle. Interventions should be individualized and delivered using behavioral techniques such as motivational counseling. Unfortunately, there are some risk factors beyond our control, such as age, gender, heredity factors, and previous stroke, TIA, or heart attack.
Smoking is a major cause of both ischemic and hemorrhagic strokes. Smokers are 4 times more likely to have stroke compared to non-smokers. The body of evidence linking smoking to stroke is convincing. It is the single most preventable risk factor to reduce the risk of stroke and a myriad of other diseases. Hence, it is important to emphasize to patients the need to quit smoking. The probability for smokers quitting becomes higher when they are provided with multiple brief contact and advice on smoking cessation by healthcare professionals. During assessment, healthcare professionals should seek out the smoking status of the patient. If a patient has been identified as a smoker, the healthcare professional should advise the patient in a clear and personalized manner the importance of smoking cessation and strongly urge patient to stop smoking. Once patient is willing to make an attempt to stop smoking, assist the smoker by referring to a smoking cessation counselor. The counselor is skilled at counseling and able to provide possible pharmacotherapy to help patients quit successfully. Lastly, Follow-up appointments and/or phone calls can be arranged to support and reinforce the patient's quit plan. Dietary advice is essential, especially for those with accompanying comorbidities such as diabetes and hypertension, where long-term control is important. A dietitian referral should be warranted if detailed dietary regimen advice is required. Alcohol use has been linked to stroke in many studies. Excessive alcohol consumption can increase blood pressure and the risk of stroke. For patients who consume alcohol, they should be advised to drink in moderation. This means less than 1 alcohol drink a day for women and 2 for men. It has been shown that regular physical activities help to lower risk of stroke. Encourage patients to increase physical activities and exercise within their own limits. To seek physiotherapist consult on the types of activities which is best suited for individuals to ensure safety. Generally, patients would be prescribed several types of new medications after stroke. It is essential to inform patients on the types and names of the medication they will be taking, the indication of each types of medications, how to administer the medications, the importance of compliance to the medications, adverse events to watch out for, as well as when to seek medical attention. This information should be explained to patients to allay their fears of taking the medications and empowering them with the knowledge on the side effects to look out for and when to seek treatment. The commonly prescribed medications include antiplatelets such as aspirin, anticoagulants such as warfarin, H2 antagonists such as famotidine, proton pump inhibitor such as omeprazole, HMG-CoA reductase inhibitors, better known as statins, and fibrates such as fenofibrate. Indications of these medications should be explained in layman terms so that patients will understand and comply. It would be prudent to advise patients to seek medical attention if they experience unresolved headache while on dipyridamole, persistent unexplained sore throat, fever, and mouth ulcer with ticlopidine or clopidogrel. Patients with unusual bleeding or bruising or black and tarry stools should seek immediate medical attention. Persistent myopathy or suspicious of jaundice should also be reported if patient is on statins. Some of the suggested ways to improve compliance to medications include synchronizing the medications to be taken with the least possible frequency, such as once or twice a day doses. Use support tools such as Pillbox and engaging family members to remind patients. For technologically savvy patients, the use of apps on smartphone can also serve as reminder to aid patients to stay compliant to the medication regimen. Additionally, identify patients' barrier that affects their medication compliance, such as understanding of medication regimen, fear of potential side effects that they might be experiencing, and financial constraints on the cost of medications.
To manage potential post-stroke complications, patients and family members should be advised on potential strategies to prevent complications and reduce impairments. The common post-stroke complications include pneumonia, UTI, DVT, and pressure sores. Good oral hygiene, early mobilization, and frequent turning are extremely important in preventing such complications. Post-stroke rehabilitation is crucial in improving functional status and quality of life in stroke patients. According to Lim et al., lack of rehabilitation often results in the rapid deterioration of patients' physical abilities, turning them frail and often needing more frequent hospitalizations later on. Hence, the importance and benefits of post-stroke rehabilitation should not be underemphasized to patients and family members. Early rehabilitation is an important key activity to recovery after stroke. It improves the patient's ability to perform activities of daily living and reduces the risk of post-stroke complications. Stroke may affect patients' ability to drive. Stroke survivors are advised on the fitness to drive before discharge from the hospital. Based on Singapore Medical Association medical guidelines on fitness to drive 2011, duration of unfitness to drive is dependent on the driving licenses group and severity of stroke. Patients may need to undergo driving assessment and rehabilitation program at Tan Tock Seng Hospital and require a final clearance by a neurologist prior to resuming driving. Details of the guideline are shown in the table. This is the guideline for fitness to drive post-TIA. Besides driving, stroke survivors are advised to avoid flying within the first 4 weeks of having a stroke. Stroke survivors should consult their doctor before flying. Stroke survivors and their family will be provided with information on community services and appropriate contact details before discharge from the hospital. They should be made aware of the availability of self-management programs and be supported to assess such programs once they have returned to the community. Here are the community resources available in Singapore. In summary, the take-home message is, stroke education is important in secondary stroke prevention. Education must be tailored to individual needs. Reinforcement of education increases retention of learned information. It is important to explain to patients why in order for them to comply with the treatment. These are the references used for this presentation. Thank you.